I'm with a company. I'm with a company called IRT Strategy. Um, a bit of background, as I was saying, that I've worked in the pharma industry for almost 30 years in sales and all the other functional areas: finance, pricing, market access, and government relations. I've worked on multiple market access, successful market access for oncology and non-oncology products. And I've got working knowledge of access area in the US, EU, and as well LATAM MENA region as well. I have had extensive hands-on experience with startups in Canada and all the necessary steps for commercial entry. In terms of what we're going to talk about today, I have a very brief on Canada at a lens from a pharmaceutical lens. General path to commercialization for pharmaceuticals in Canada, and potential approaches that someone can take, or a company or an entity or person with an asset can take. In terms of the Canadian market, it's about $37 billion in prescription pharmaceutical market. It's the 8th largest in the world with 2.8% of the global share. And our Canadian spend on healthcare is about $8,700 per year. In the Canadian pharmaceutical space, high innovation areas are increasing their share of the market. And when you license a product to a partner in Canada, it usually lowers the value of the asset. Our healthcare infrastructure is robust. From the outside looking in, it may seem that it's multi-layered, but it is a defined pathway, if you will. Our regulatory and pricing is referenced in a lot of jurisdictions around the world. On the right-hand side, you see the total distribution of our market. About 46-47% of it is public, meaning government pays for it, provincial formularies, federal drug plans for employees, NIHB, so on and so forth. Hospital inpatients, as you are aware, Canada Health Act stipulates that any products that gets infused or taken in an hospital setting must be paid for by the public system. So that's where the hospital inpatient therapies come in, and cancer agencies. As you are aware, cancer products, if they go through the process and get government listing, they are paid free of cost to the patients from the public side. Private side is the employer-sponsored drug coverage for employees and their families. It's about 40% of the market. And the 14% of the market is no coverage, underinsured, non-reimbursed drugs, and as well deductible copays. On the private payer side, most insurance companies do have copays anywhere between 5% to 20-30%, depending on the plan and your employer. And that's where that out-of-pocket expense comes in. So that's in a nutshell in Canadian market. From outside looking in, as I was mentioning, it may seem it's very complex, but when you peel away the layers, it's actually no different than the US market or the European market. Yes, we have our nuanced approaches to things, but in broad stroke, they're fairly similar to other markets, comparable markets in the world. So what happens in Canada? You get the regulatory approval. It's a defined process, as many of you may be familiar with our regulatory regimens. We have collaborative arrangements with both FDA and EMEA, and FDA, EMEA modules are essentially repurposed. So if Canadian submission happens before the US or EMEA, then we have to write the modules ourselves. But if FDA submission has been made or is being prepared, then those modules can be repurposed. Many of you may be familiar with the modules, and they're quite extensive, scientific, heavy content, if you will. In regulatory approval as well, the Health Canada, the regulatory body, does like to see the need for a product. So there could be 5 other products in the therapeutic area, Health Canada, it is always beneficial to impress upon them the need for it. So an HCP to go to Health Canada and say, this is where this product or this technology might be used. As a regulatory body, Health Canada and all the other regulatory body, they look at the evidence, they look at the documents, whereas an HCP can provide some color into it. So once we get the regulatory approval, Canada is a HTA jurisdiction. HTA is Health Technology Assessment, meaning there is a secondary layer of review that has to happen because our public system pays for it, and they just don't pay for anything that gets regulatory approval. So we have 2 HTAs in Canada, one for English Canada, and you might guess, one for Quebec. And we have about 20 major private payers. So we have to make submissions for those. In that process, HTA process, there is a formal and informal HCP and patient group advocacy room. In other words, as we go through the process, there is a formal submission that HCPs and patient groups can make, and as well as the informal ones that they make through the provincial formularies. Usually, those reviews take about 6 months. You can make a submission to HTA prior to regulatory approval. Once the HTA and private payer review happens, then we move into something called net price negotiation, which is very confidential. Only government and the manufacturers know. This is when you negotiate as to what price the government or the private payer would pay. It happens post HTA. In the HTA review, they will recommend if it is to be listed or no, or what type of price reduction they recommend. And in the price negotiation, you actually do the negotiation. Again, HCP and patient group advocacy is key during that process. So once that process concludes, then you get the reimbursement. And as you know, our healthcare is a provincial jurisdiction, so you have to have individual contracts with individual provinces after the net price negotiation. And then once you have the contracts done with the provinces list them, or the private payers list them, and the product is available. So you go to your physician and they write a prescription, and you go to the pharmacy and someone is paying for it in the background if it has gone through these reviews. Usually the whole process from the time that you make a submission to regulatory to actually having the product available in Canada, it's about 24 to 30 months. There is an elasticity to this timeline due to multitude of factors. If a product gets priority review, and how well are you willing to, or how eager are you to conclude the net price negotiations, because that is the one that doesn't have a defined timeline. So if you are negotiating aggressively, you can shrink that timeline. In Canada, there is another body called PMPRB that determines our ceiling price, meaning that is the maximum price a product can be charged for in Canada. And that is based on international referencing. International referencing does not include US, as you may know that US prices are almost 45% more than Canada. So it's not part of the basket. It's all the European markets, plus Australia and Japan. There are international reference. We get the median of those places if the product is available in those places. When you're launching the product in Canada and the product is not available in those jurisdictions, then you're compared to what is used locally. And there is a formula which is beyond the scope of this discussion today. So I'll just pause here for a second to see if you have any specific questions. Otherwise, you can hold on the questions after we do the presentation. So this is a general schematic of commercialization in Canada. And then, so what are the approaches that companies can take? You can take approach A, which is you set up an affiliate. So you hire a GM, regulatory, market access, medical, and commercial. And as you may guess, Canada is a large country. So per employee contribution is a bit lower in Canada versus similar jurisdictions in Europe. For example, in Netherlands, a rep could essentially cover the whole country. In Canada, you need 3 reps, one for Ontario, one for out west, and one for Quebec. It's just the reality of our geography. You could also do approach B, where you hire a project manager to to walk you through or take you through the regulatory and market access, and then you decide. Because as you know, there is no certainty around regulatory or market access. So for organizations and companies, it may make sense for them to essentially have the predictability of regulatory and market access sorted out before they make investment of hiring a general manager and regulatory market access, all the other commercial folks. You could also do the approach C, which is licensing to a partner. Canada-specific licensing agreements are not many, if you will, and they are challenging, if you will, require significant internal resource. Licensing agreement for ex-US markets usually include Canada as part of the EU clusters. And as you know, there is almost 40 to 50% royalty that has to be paid. So if you're licensing out an asset to a partner specific for Canada, it may have an impact on the asset if you're trying to sell the asset or the company. So how much does it cost? So approach A, which is if you hire a GM, in total, without getting into the nitty-gritty of the numbers, it's about $13–14 million over 2.5–3 year time period. By the time you actually start earning revenue, which is post-reimbursement when you have the contracts as we talked about and what have you. The approach B, which is the project manager approach, essentially that takes $2.9 million. These are estimated figures. They may be a bit more, a bit less. As you will see, the OPEX column row on both of them, these are fixed costs. So OPEX in the project manager, there is Health Canada fee of $600,000. There is HTA fee, development fee. So these are essentially table stakes. They have to be paid. Like there is no negotiation fee. So all told, approach B, 2.9, approach A, which is you set up your own office with the necessary footprint in Canada, as we talked about Canada being a large country, 13.7. And approach C is licensing out. Again, there are pros and cons for all 3 approaches, and it all depends on where in the life cycle of the organization is and what their overall strategy is for the asset that they're contemplating bringing into Canada. That's essentially what I had. I will just stop here to see if you have any questions.
Fantastic presentation, Faizan. Thank you so much. Very interesting, and the details and the pricing and the budgets is very enlightening. Any questions from the audience?
Yeah, I've got a question. When would you recommend to people to start thinking about their pricing and reimbursement strategy? Clearly not when you've got regulatory approval and go, oh, now I need to get it reimbursed. But how early should you really start thinking about that?
I would say, like ideally, in an ideal world, it should be 1 year before you actually make the regulatory submission. Because in Canada, as you probably are aware, there is parallel review that you could do with regulatory and market access HTA, so you can shrink the time to commercialization, if you will. You can expedite the time of your HTA review if you sign up for parallel review with Health Canada. As you're making your regulatory submission, you need to have a clear picture of the commercial end goal. As you know, a simple word change in the label could have a significant impact on the reimbursement of the product, because the label dictates the criteria of where the product is going to be reimbursed for. And there are a multitude of things that during the regulatory file that it is always beneficial to have that market access and commercial end goal in mind. So I would say in an ideal world, a year in advance, but you would need at minimum 6 to 9 months before the regulatory submission. Remember, you can make an HTA submission about 6 months before you're expecting the regulatory approval. And if you're planning to make that HTA submission 6 months before your regulatory approval, it takes almost a year and a half to develop the HTA dossier, develop the advocacy with the HCPs and clinicians and the patient groups. So you do need to provide that runway. As I said, ideally 1 year before the regulatory submission, but 6 to 9 months is a must.
Great, thank you. I saw Quentin had your hand up. Do you still have a question, Quentin?
Yes, I'm still a student, so some of the questions I ask may come off as theoretical and really. So when we get a license, does that have an impact on do we plan for how an annual license review impacts us getting a license? So as I understand it, for example, when a company receives its medical device establishment license, and that happens, say, in February, when that happens, and then they still need to submit would still need to submit our annual license review before the 1st of April. So when I learned about that, I was then asking myself if that has an impact on how the company manages that. I don't know if my question makes sense.
Yeah, so like it's a medical device area. So medical device area has various different regulatory framework that is somewhat different and nuanced than the biopharmaceutical and pharmaceutical area. What you're referring to is yearly license renewal for medical device. That is an area that I'm not very familiar with. But in terms of market access for medical device, again, that process is also 3 to 4 years in time. And there is a sort of a quasi-review body in Ontario called OTAC that reviews it for all the medical devices for the country. And there is a significant healthcare, HCP advocacy required. But in terms of the Health Canada licensing, I'm not very familiar with the gist of your question.
Okay, thank you.
All right, well, thank you. In the interest of time, we're going to move on to the next presentation. So thank you, Faizan, for that.